Every time I go to the hospital, I collect one from the play lady.
Oliver has around 3,000 beads. Each one a reminder of every treatment he's received during a lifelong battle against a rare form of cancer.
The white one means chemo. The black one means needles.
His older sister Macy has helped to support him through all his physical and mental health challenges. But Oliver only started receiving mental health care from his hospital in the last year, after he started hearing voices in his head.
Everything that he's been through is obviously difficult for anybody to deal with, but the fact that he's not had anyone there supporting his mental health makes it so much worse, because he just suddenly goes from happy and bubbly to everything kind of comes crashing down and affects him so negatively.
Young Harrison is being treated at the same hospital as Oliver. Doctors found a tumour in his brain when he was just 8 months old. In all, he's had 23 surgeries, and they've all been life-changing. Now he's disabled, non-verbal, and will need help for the rest of his life.
You're not doing normal things, you're not going out and seeing friends and family, you're missing birthdays, and that's mentally hard. We spend definitely more time here than we spend at home. It's like here is home now, which is quite sad, but it is just our reality.
The specialist doctors here know children like Oliver and Harrison with long-term physical conditions often suffer mental health challenges, but they say they don't have the means to help.
The support that society and the National Health Service is able to give children and families is dire, and that needs to be increased. We need not necessarily doctors and senior psychologists, but we need some basic well-being and emotional health support for children and young people.
Young mental health patients who require inpatient treatment are referred here to the Croft Child and Family Unit. The specialist care staff here hope a proposed new hospital, the first to combine treatment for physical and mental health needs, will take pressure off their services.
We see children and we see unmet needs, and that's really difficult to work with, because we're all here working really hard to support families and children with mental health difficulties, and the services just aren't, they're just not there to support children and their families.
Groundwork on the first specialist children's hospital in the east of England is slated to begin next year. But across the country, children like Oliver and Macy are all too often relying on charities and each other in their toughest of times. Ashish, Joshi, Sky News.